Hello and welcome to Talk Time on Lugard TV. I am Dominion Adeonju. Joining us today in the studio is the Chief Medical Director, Kogi State Hospitals Management Board, Dr. Ayo Olayemi. Thank you for joining us today,
Thank you
sir.
very much.
Thank you so much, sir. What are the core mandates of the State Hospitals Management Board?
Yeah, the core mandate of the Hospital Management Board is to see the overall management of the staff working with the hospitals in the state.
Okay, sir.
And this comprises the doctors, the nurses, even the attendants to see to their welfare, recruitment exercise, and discipline, if possible.
Okay,
Yeah,
sir. Sometimes in the past,
yeah.
we were told the state was not attracting medical doctors and health workers to our healthcare facilities. Has the situation changed now?
Very well. It has
Okay.
changed positively.
Okay.
And it's not even been hyperbolic. Before the incoming government, the former governor, Bello, built 3 state-of-the-art hospitals to join the ones on the ground. We have one in Gegubeki, ultra-modern general hospital. You need to go there and see the equipment there. We have another one, ultra-modern general hospital, Badoko in Ajakuta local government. And there is another one in Isolu General Hospital. You may have heard about this, that there's another one built by His Excellency Alhaji Usman Ododo, even before he became the governor of the state. That one is Ajia Awao Bello Memorial Hospital in Upogoro. Added to this is another one built by the wife of the former governor, Bello. That one built in Eka. You need to get there. They are all state-of-art hospitals.
Yeah, the welfare of medical practitioners is very imperative. Can you tell us some of the initiative that has been put in place to see
Yeah,
to that?
very good. Before now, like you rightly said, you know, some doctors come into the state, and before you know it, they're all gone. During the implementation of minimum wage, I think, without being immodest, Kogi State governor was one of the first governor to ever, bring on board to implement the minimum wage. Not only for the doctors, for all workers across board. And we're all happy for that. For now, we have a mission, we have a target. We are not yet there, but we'll soon get there. Because the 2024 comment that we're agitating, His Excellency is working on that. And my Honorable Commissioner, my principal, is on top of the game.
All right, sir. The administration of Governor Ahmed Usman Ododo recently announced 65 years chronological retirement age and 40 years length of service for healthcare professionals in the state. How did you receive the announcement?
Of course, with joy. Not only me, all the workers across board, they received with applause.
Okay.
Because we didn't see it coming so soon. We know that the federal government had made that pronouncement. But it takes a lot of time before most states will key into such a program. You agree with me that even as we're talking now, some states, they have not even implemented the minimum wage for the workers. But here we are. During the Workers' Day, it never even crossed my mind that His Excellency was going to make that pronouncement. I immediately made that pronouncement. My nurses, my doctors, they were calling me all over the place. And I said, yes, this is true. It's not an imagination. But some of these things, they have to be properly harnessed in terms of documentation. And we'll get there.
Okay, sir. As a senior medical professional, how has your experience been valuable in mentoring younger professionals in the field?
Great. I'm bringing in a lot of experience because I've worked in the Ministry of Health before. I've been medical officer in so many of their facilities in the state before coming to the ministry. And I rose up to become the Director of Public Health when I retired in 2018. And that experience has come to stay with me, so much so that right now, I don't leave things for chance. And what I do is to make sure my directors go to the facilities to mentor them, to see things the way they're supposed to be. Where they're going wrong, make sure you. Right now, I've told them if there's any hospital in the state, they have an acute emergency, and they are not being attended to within the first 30 minutes to 1 hour, they should let me know. And those who err, they know what they have received from me.
Okay,
in terms of being sanctioned.
All right.
Yeah.
I've heard from a very reliable source about how much you take very good care of the healthcare workers in the state.
Yeah.
I heard also about some transportation implementation that has
Yeah.
been put in place. Can
Yeah.
you speak about that?
Yeah. You see, most of the time we say, oh, the government has not done this. Well, you yourself, what did you do, or what are you doing to help the government? And that's why when I came on board, His Excellency, the former governor, released 2 brand new helices for me to augment the bus that was on ground. So, in my own little wisdom, I said, okay, this bus, what am I going to use it for? Instead of parking vehicles just lying down there, why don't do I do something? So, I got it repaired to make sure it's very functional. And I fuel it every week. Initially, it was meant for my workers at the board, so that my driver will wake up early in the morning, go around some streets, especially the post office, the Ganaja Junction, and some other places, pick them up towards the closing time, at 4 o'clock, pick them back to their work at no cost to any of the workers, and they're all happy for it. Yeah.
That's a very laudable
Yeah,
achievement.
yeah.
Now, away from all of this, on a personal note, I am told that there's a special connection between you and the family of Governor Ahmed Usman Ododo. Would you want to say something about it?
You are bringing in emotion again. Yeah, personal connection indeed. This is a thing that I do it on daily basis without winking an eye. I have an hospital in Okene, Ateba. That is a very constituency of Governor Bello. It's a laid down rule. If you come around there and you don't have money, nobody drives you because you don't have money to pay. Make sure even if I'm not around, they know it's a standing rule. And on this very day, which, quite a long time, 1997, His Excellency brought his mother. I wouldn't have I don't have to have the merit to say this because he mentioned it. Otherwise, so many of these things are confidentiality. But when the owner concerned decides to make it public, otherwise you will not hear that kind of thing from me. So, and she came around. The situation was very bad, and she's been to 3 other hospitals, and was rejected. And just said, okay, let me try this one. And when he tried it, lo and behold, it's like God sent me and said, okay, don't worry. We were able to intervene surgically in form of operation the following day. I did the operation personally by myself, had some blood transfusion. And when he came around, where's my mother? Look at your mother there. And saw her already moving around. He was perplexed and said, Kai. So, and that thing has remained with him and remained with me. And it may interest you, not the only one that has happened to. It was when His Excellency blew this up that other people started calling me. That, my father too, you did. Former Minister of Justice called me. I said, my father was with you. Yeah, that's right. And he had the same testimony. Even the chief of staff himself tapped me and said, look, I won't be able to remember that. You were very, very young to be. And so he spent 10 days in my hospital, and you can never forget that. So there are many others like that.
Yeah.
And to God be the glory. There are some who we did that to, they ran away. Like I remember some people, they wanted to deliver, they couldn't make it. They've been to government hospitals, and because they didn't have money, they know when you go to Dr. Laimi, it's likely to do it without collecting money from you. So I will do it. Say, okay, when we're finishing the operation, before being discharged, you pay. But when it comes to the night of being discharged, at the middle of the night, they run away. But we thank God that has not diminished me in any way. We're still living. We thank God for that. Yeah.
So I would like to know the lessons that these actions you've portrayed has impact on people with private hospitals and all.
You see, even His Excellency made it known to my colleagues when they came visiting, telling them, I wish all of you will do this. The whole world will be beautiful. And I can tell you, whenever I go around, some of my junior colleagues keep on telling them, whatever you do today, you repeat tomorrow.
Yes.
is a lesson for tomorrow. Nothing goes unannounced. Nothing goes unpaid for.
Yes.
If you do bad, you pay for it.
Yes.
If you do good, you pay for it. So on my own little way, each time I go around, say, why? Is it because of money you don't want it? Do you know, are you going to go, whatever you think you earn or you own, it's not you. If you have 10 houses, whether you like it or not, one day, you will leave those houses. If you have cars innumerable, one day you will leave it. So why don't you just take it easy and do whatever you want to do? We keep on preaching that. It's a gospel. We evangelize it to some as general doctors. Don't think of money alone.
We hear that you're from Kogi West
Yes,
of
please.
Kogi State.
Yes, please.
We also hear that you have your hospital in the Kogi Central.
Yes.
What would you say informed this decision you made?
Well, when I graduated, the first place I was posted to was General Hospital, Okene. And I objected to it. The reason is because I was born and brought up in Lagos. And most of my school days in Lagos and eventually went to Ilorin. So when I graduated and I was posted to Niger State, also I rejected it. I went back to Lagos. I wanted to a reposting. But somebody told me, no, you can't be changing everything all the time. So I accepted and stayed in Niger State. When I came back, my first posting was General Tokeni. I rejected it. But my director told me, look, Dr. Layemi, let me tell you one thing. Where you gain experience in terms of volume of patients, senior doctor that will guide you, go there. And I accepted and no going back. I've never regretted it. Because got there, I got married and established a hospital. And that's why most of the time when you ask me, where's your constituency? I'm from a Gasa constituency. Because that's where I built my hospital. It may interest you, the 4 children I have there, I have my name, the native name, and Hebrew name. The first one is Oiza, my name. She's in US now. The second one that follows him is Onimisi. The one that follows him is Onene. That's the little girl in the house. And the last one is Omeza. So all of them, they have their own native name. And whenever they are traveling outside the country, it pays for them. Some of my children in Texas will say, wow, are you an Ibra? They'll laugh it off because they say, yes, I am, I'm not. And they get integrated. That speaks volume. Because right now, if I sit down, most people that come around me in the state or in Abuja, most of them, 80% of the time, they're Ibera. Yeah. So that is a lot of integration that the former governor was preaching, which this governor has continued to preach.
Yeah. This just goes to show how many we have in Kogi
Exactly.
State. Yeah. Thank you very much for joining us today, sir. Thank you for taking time out of your busy schedule to be here.
Thank you very much.
Yeah. And that's it on Talk Time on Lugard TV. You've heard from the great CMD of the Kogi State Hospital Management Board. We've spoken about the state of the health facilities in Kogi State presently, and he has gone about to show us how much harmony is in the state presently. Until next time, I am Dominion Adeonchu. Thank you for staying with us.